If you're currently pregnant and experiencing hip pain, we are going to go over today why that happens and what you can do about it, how you can sleep, what moves you can do to open up your hips, and to overall relieve pain during pregnancy.
Okay, I just shouldn't have worn a dress for this.
So, first of all, you should know that it's normal to get aches and pains, especially in your hips while you're pregnant. Pregnancy hormones in general relax your ligaments, and this loosens up your pelvic bones so that they can shift while you're pregnant. They're mainly shifting in order to open for childbirth, but that can result in some hip pain while you're currently pregnant. 1 in 3 pregnant women experience hip pain during pregnancy, and it especially gets worse in your second and third trimesters as your hips loosen up to prepare for birth. The growing baby, especially in the last trimester, adds additional pressure to your hips that open that up and can cause hip pain. So, one way to relieve hip pain is to change the way that you are sleeping while pregnant. The first big tip is to get a pillow or a small piece of clothing and place it underneath the curve on your hip. This helps to spread apart the weight that's being distributed while you're sleeping so that all of the pressure does not fall on just your hip. I'm gonna do a quick demonstration. Good night. Okay. Personally, I think that this pillow is a little bit thick and it doesn't totally distribute the weight, but you can use a folded up scarf or another smaller pillow or even one of those mini yoga balls that's like this big that's very frequently used in Pilates. So that's one way to change the way that you are sleeping to help relieve hip pain. Another important tip to remember about sleeping while pregnant in order to relieve pain in general is if you're going to sleep on your back, you should slightly elevate your back so that you can keep blood flowing. However, after 20 weeks of pregnancy, you're in general not recommended to sleep plainly flatly on your back, as it can generally be uncomfortable. So instead, try something more along the lines of this. Another hot tip, if you are having trouble sleeping while pregnant, is to stretch out your hips prior to sleeping. You can just generally get a tennis ball or a little massage ball. I got this one on Amazon and it wasn't that expensive at all. And you can just kind of place it in between your bones where your muscles are around your hips and start massaging it against a wall. If you want a lot of pressure, I would definitely do it against a wall. A fun fact about me is I actually do have tight hips. So it's really easy for me to pinpoint where I should massage because it's really painful to place a ball there, but it does feel like a good kind of pain because I'm relieving the tension that I have in my hips. So, if you already have tight hips, you can kind of feel around for where the knots are in your muscles around your hips. So, that would be not the bone part around your hips, but the muscles around your hips. And you can just kind of move the ball along the wall in order to slowly massage your hips out to open them up and relieve hip pain that you're experiencing while pregnant. So, you can kind of go side to side. You can also go up and down. I would recommend placing your weight on the opposite hip from the one that you're massaging and then just placing the ball right on the hip where you don't have any weight so that it's not the muscle isn't flexed or anything like that. And then you can just go back and forth to massage it. And I would do this for about 5 to 10 minutes. If doing these hip stretches against the wall is a little too difficult, then you can also just do it straight on your bed. Because your bed is cushy, it will be able to absorb some of the pressure. So the pressure won't be as hard between the ball and your muscle, so that it won't be such a difficult massage, but you can still help to massage it out. So I'm going to demonstrate. So you can see placing the ball underneath and just kind of moving around here to help massage your hips. I have a lot of tightness on my side in particular, so it helps kind of be in this position. The very last sleeping tip that I have in order to help relieve hip pain during pregnancy is to use a pregnancy pillow to support your pelvic region. So, in particular, if you do kind of the classic side position with your pregnancy pillow and place the pillow between your knees, then you can help to even out the pressure that's going on the hip that you're lying on. And that way you can help relieve hip pain as well. So, I personally think that that is why pregnancy pillows are so popular. And fun fact, if you also happen to follow the infamous longevity influencer Brian Johnson, he says that he gets the best sleep when he's on his side and and has a pillow between his knees. So, in general, even if you're not pregnant, I think that this is a good thing to keep in mind. It helps to even out the pressure that's happening across your body and it helps you sleep peacefully. So, I'm gonna demonstrate with this pregnancy pillow, which I also got on Amazon and it was way cheaper than I thought it would be. I thought pregnancy pillows normally were $100 plus, but this one I believe was around or less than $50 and it was a good find. So here is how you use a pregnancy pillow. So I think you have something to snuggle with and also even out the pressure. Like you don't want your arm to be kind of like this. So you have a place for it to rest here. And then you can put this in between your knees so that you can even out the pressure. Okay. Like so. This is honestly a quality pregnancy pillow. I got it for this video, but I might just keep it. Okay. Now that we've covered all of the sleeping positions that you can do to relieve hip pain during pregnancy, we're going to move on to some stretches that you can do to relieve hip pain during pregnancy. Stretch number 1 is going to be a lying down figure 4.
Okay. I just shouldn't have worn a dress for this.
Okay, so this is the lying down figure 4, which helps to stretch out your glutes especially. So you want to put one leg over the other, weave your hands through, and just try to push back to stretch out your hips here. If you'd like, you can also do a modification for that where you're sitting. Okay, next we have a pigeon pose, which is the typical pigeon pose that happens in yoga, and it also helps to open up your hips. Okay, like so. Okay. Okay, and lastly, the next stretch that you can do is kind of just twisting your body while you're lying down. And this can also help to open up the hips. And the other ones are things like happy baby and other hip opening yoga motions that you can do in order to really relieve pain in your hips. So this is the twisting motion. So you can keep this leg straight, bring this leg over, and just try to twist this way to open up your hips and stretch your back out as well to relieve tension. Lastly, I'm going to demonstrate the cat-cow, which is also a typical yoga position that's done, but it can also help to open up your hips. One of my friends who's a yoga instructor actually calls this her wiggle movement because you can wiggle while you're doing it and just open up your body, listen to your body, and move with it to relieve that pain. Okay, so the typical cat-cow, you just bring your knees shoulder width apart and then arch your back and then bring it back up, arch it again. So yes, if I can do this in a dress and a white coat, you can do it too while pregnant. Lastly, I wanted to go over some posture adjustments that you can make while pregnant in order to relieve tension and overall more evenly distribute the weight throughout your body. Tip number 1 is typically when you're pregnant, you are inclined to lean your head forward, but it's important to actually keep your head up straight as though someone is pulling a string above your head so that you can keep your neck elongated and completely straight up. Alongside that, typically people look somewhat at a downward angle when they're pregnant because they're inclined to let the baby weight kind of push them forward or arch their back a little bit. But you want to keep your eyes on the horizon, and that's alongside keeping your head completely straight. Similarly, when you're pregnant, you're inclined to round your shoulders, but you want to try and keep your shoulders straight up. Also, when you're pregnant, you tend to have a collapsed core, but you want to try and keep the core engaged and straight so that you can evenly distribute the weight throughout your body. Another tip is that you typically tuck your tailbone when you're pregnant, so that causes you to kind of sit more like this and stand more like this as well, but you want to try and actively untuck your tailbone so that there's it's almost like a slight arch that's happening in order to just untuck it and let it out. And then lastly, you want to make sure that when you are standing while pregnant, you do not lock your knees. In general, you don't want to lock your knees, but you want to make sure that you're allowing movement to happen. And this way you can relieve hip pain. Finally, I wanted to go over some don'ts while you're pregnant in order to relieve hip pain. So, number 1, you do not want to hang on one hip, which is where you're basically putting all your weight on one hip, similar to how when people stand like this, then they typically distribute all their weight on one hip, but you want to keep it even. Tip number 2, try your best to not walk on uneven ground. It can definitely be difficult, especially if you live in an area that has less cement, for instance, but that could also result in uneven distribution of weight, which can promote hip pain. So you definitely want to try and avoid uneven surfaces. And lastly, try not to cross your legs while sitting like this, because that can also result in uneven hip pain. Same thing with crisscross applesauce. When you sit that way, it kind of unevenly distributes weight. So you want to make sure that you are staying away from that. So, my name is Catherine. I'm the founder of Anja Health. We help pregnant parents freeze stem cells from their umbilical cords and placenta to use for potential future disease treatment in their family. So, I spend a lot of my day talking to OBGYNs, looking into evidence based pregnancy resources, and overall just making sure that parents feel supported walking into birth. So, that was our mission today. If you like this video, please like and subscribe to our channel because we are going to post a lot more evidence based oriented OBGYN backed pregnancy content. And you can also check out our Anja Health podcast where we interview a lot of providers, including OBGYNs, doulas, midwives, labor and delivery nurses, and more. Hope to see you soon.